Good morning, everybody. Today we are going to talk about anatomy of skin. In this session, we are going to describe structure of skin, its functions, anatomical basis of skin pigmentation, and some MCQ type of questions at the end of this session of revision and assessment. Skin is also called integumentary system. This system consists of skin and its accessory organs, which include hair, nails, and cutaneous glands, which are in the form of sebaceous and sweat glands. Skin is most visible system of our body, and more attention is paid to this organ system during clinical examination because many diseases present with skin manifestations. An inspection of the skin, hair, and nail is a significant part of clinical examination. Skin is most vulnerable organ of our body. It is exposed to radiation, trauma, infection, and injurious chemicals. A sound knowledge of skin is essential for all clinical practitioners. Weight and surface area of skin. Since skin covers all other organ systems of the body, it is the largest organ of the body, keeping in view its surface area. It is also the heaviest organ body. The surface area of skin ranges from 1.5 to 2 square meters. The weight of skin is about 15% of body weight. Now, what are various layers of the skin? Skin is divided into three layers. The outermost layer of the skin is called epidermis. Below the epidermis is dermis, and deeper to the dermis is hypodermis, which is also called the subcutaneous tissue and contains subcutaneous fat. Epidermis is composed of stratified squamous epithelium. It is avascular. Dermis is composed of elastic tissue. It is rich in blood vessels, lymphaticus, and nerves. Hypodermis, as already said, is another connective tissue layer below the dermis. It contains lot of fat. Epidermis mainly performs the function of protection. Dermis nourishes the epidermis and contains lot of sensory nerves, so acts as a sense organ, and hypodermis isolates our body and is concerned with fat metabolism. What is thickness of skin? Mostly the skin covering body is 1 to 2 millimeters thick, but the thickness ranges from 0.5 millimeters on eyelids to 6 millimeters between the shoulder blades. Thick skin is present on palms and sole. This skin is rich in sweat glands but has no hair follicles or sebaceous glands. In thick skin, epidermis is 0.5 millimeters thick. Thin skin covers rest of the body. For example, eyelids are covered by the thin skin. Here the thickness of epidermis is 0.1 millimeters. So thickness of skin is also determined by the thickness of epidermis. Thin skin contains hair follicles, sebaceous glands, and in addition to sweat glands. Thus, sebaceous cysts develop only in the thin skin. Now, what are the functions of the skin? As already said, skin has three layers. Each layer performs its own functions. Epidermis mainly protects our body. Dermis acts as a sensory receptor and nourishes the epidermis. And hypodermis, containing fat, insulates our body and is involved in fat metabolism. So first function of the skin, since it covers the body, it protects our body from trauma and infection. Other barrier functions include waterproofing, protection of underlying structures from ultraviolet radiations, and also from harmful chemicals. Vitamin D synthesis. The first step of vitamin D synthesis occurs in skin. Vitamin D synthesis is completed in liver and kidneys. Storage of fat. Since hypodermis contains lot of adipose or fatty tissue. In the dermis there are a lot of nerves. That is why skin acts as the largest sensory organ of our body. Thermoregulation is an important function of skin. Whenever the temperature rises, blood flow to the skin increases, leading to evaporation from the surface of the skin, with the result producing a cooling effect. In contrast, when the temperature of the environment decreases, blood flow to the skin also decreases. Thus, reducing heat loss. As shown in this diagram, blood flow to the skin increases when the external temperature is high and decreases when the external temperature is low. Non-verbal communication. It is said that face is the index of mind. Skin plays an important role in non-verbal communication as shown in this figure. Another important function of the skin is transdermal absorption of drugs. In medical practice, drugs are given in the form of patches which are applied to the skin. These drugs, being lipid soluble, enter into general circulation through skin. Now, what is the blood supply of the skin? As already said, skin has three layers. Epidermis is avascular, so it does not contain any blood vessels. Dermis is highly vascular. It contains blood vessels which include arteries, veins, lymphatic vessels, and nerves. The vessels of dermis nourish epidermis. There are a lot of nerve fibers in the dermis. These nerve fibers carry sensations from skin to the central nervous system. The third layer of the skin is hypodermis, which contains lot of adipose tissue in addition to blood vessels, nerves, and lymphaticus. Adipose tissue insulates our body. Deeper to adipose tissue is deep fascia, which is a dense connective tissue, and below the dense connective tissue are muscles of the body. Now, what is innervation of the skin? We say skin is the largest sensory organ of our body. What is the anatomical basis of it? In the hypodermis of the skin, there are free nerve endings which carry pain, heat, and cold sensations from skin to the central nervous system. In addition, there are Merkel's discs, root hair plexus, and Messner's corpuscles. These sensory receptors are for pressure. In addition to this, there are receptors for touch in the form of Kras and bulbous and Ruffini's endings. Thus, skin is richly innervated. It contains receptors for pain, heat, cold, pressure, and touch. Now, what are the layers of skin? As already said, skin has got three layers: epidermis, dermis, and hypodermis. Now, what is epidermis? Epidermis is composed of stratified squamous keratinocyte epithelium. It is divided into five layers: stratum basale or basal layer, stratum spinosum, stratum granulosum, stratum lucidium, and stratum corneum. Now, what are various types of the cells in the epidermis? In the basal layer of the epidermis, there are, as shown in this diagram, in the basal layer of the epidermis are pluripotent stem cells. These stem cells differentiate to produce other cells of the epidermis. Another type of cell present in the basal layer is melanocyte. This melanocyte synthesizes melanin, which is responsible for pigmentation of the skin. Tactile cells present in the basal layer are responsible for sensations. There are also dendritic cells present in the epidermis. In addition to keratinocytes, we synthesize keratin. So various types of cells which are present in the epidermis are: epidermis is keratinocyte stratified squamous epithelium. There are five types of cells are present in the epidermis. They are stem cells, which are undifferentiated cells that give rise to keratinocytes. These cells are present in the deepest layer of the epidermis, that is stratum basale. Keratinocytes, which are present in the stratum basale, they produce keratin, which is responsible for keratinization of epithelium. Melanocytes present in the stratum basale produce melanin, which is responsible for pigmentation of skin. These cells possess branched processes that spread among the keratinocytes. Tactile cells in the form of Merkel cells are also present in the basal layer of the epidermis. They act as the touch receptor cells associated with dermal nerve fibers. Dendritic cells of Langerhans, they are macrophages originating in the bone marrow found in the stratum spinosum and granulosum. They stand as a guard against toxins, microbes, and other pathogens that penetrate the skin. Now let us go for a brief description about the layers of epidermis. As already said, epidermis contains five layers. Stratum basale or basal layer is the deepest layer of the epidermis. It is a single cell layer of cuboidal to low columnar stem cells and keratinocytes resting on the basement membrane. There are melanocytes and tactile cells scattered among the stem cells and keratinocytes in this layer. Stem cells of stratum basale divide. They give rise to keratinocytes that migrate towards the surface of skin and replace the lost epidermal cells. Stratum spinosum, as the name implies, it is the microscopic appearance of these cells that gives them the name stratum spinosum. It consists of several layers of keratinocytes. This layer is the thickest stratum in the most skin. Deepest cells remain capable of mitosis. As the cells move towards the surface, they cease dividing as they are pushed upwards. They produce more and more keratin filaments which cause cells to flatten. Higher up in the stratum, the flatter the cells appear. Dendritic cells are found throughout this stratum. These cells are named as spinosum for their artificial appearance created in histological sections. Since the cells are adherent to each other by desmosomes, and when the cells are separated from each other during the tissue processes, it gives them supine appearance. So this layer is named as stratum spinosum. So cells get separated from each other except at the sites of attachment, that is where desmosomes hold two cells together. This gives this layer a supine appearance and is called stratum spinosum. As already said, in the cells in the basal layer or columnar, as these cells move towards the surface, they become squamous. They lose their nuclei, cell membrane, and finally become acellular and or in the form of keratin. Stratum granulosum consists of 3 to 5 layers of flat keratinocytes, contains coarse dark staining keratinohyaline granules. In this layer, these cells produce lipid-filled vesicles that release a glycoprotein by exocytosis of waterproof skin. It forms a barrier between the surface cells and deeper layers of the epidermis. It cuts off surface strata from nutrient supply. Stratum lucidium, it is seen only in the thick skin. It is in the form of a thin translucent zone superficial to stratum granulosum. In this layer, keratinocytes are densely packed with lutein. Cells have no nucleus or other organelles. This zone has pale, featureless appearance with indistinct boundaries between the cells. Stratum corneum, it is up to 30 layers of dead, scaly keratinized cells. It forms a durable surface layer. These cells flake off or exfoliate and are resistant to abrasion, penetration, and water loss. Now, what are melanocytes? These cells have multiple processes. They produce melanin. They are scattered throughout the stratum germinatum. Melanin is a pigment which is responsible for skin pigmentation. Absence of melanin since birth leads to albinism, that is generalized hypopigmented skin. In contrast to albinism, in vitiligo involves patchy loss of skin pigmentation. What is vitiligo? Vitiligo occurs when pigment producing cells die or stop functioning. Loss of skin color can affect any part of the body, including mouth, hair, or eyes. It may be more noticeable in people with darker skin. Now, what are keratinocytes? As already said, in the stratum basale, there are keratin producing cells called keratinocytes. These cells are scattered among the stem cells and other cells of stratum basale. Stem cells of stratum basale divide and give rise to keratinocytes that migrate towards the surface and replace the lost epidermal cells. During migration, shape of the cells keeps on changing, where finally they become squamous for adaptation to the less vascularity. Let us go to the life history of the keratinocytes. Keratinocytes are produced by the stem cells in the stratum basale. Some deepest keratinocytes in the stratum spinosum also multiply and increase their numbers. Mitosis requires an abundant supply of oxygen and nutrients. The cells located close to the dermis acquire their nutrition from dermis and or columnar in shape. As they move away from the blood supply, shape of these cells changes. They produce more keratin, lose nucleus, and finally they also lose the cell membrane. So initially the columnar cells, they produce less keratin. As the cells move higher up, they move away from the nutrition, they receive less nutrients and oxygen, produce more keratin, and finally become acellular. That is why the shape of the cells changes from columnar to squamous. Finally they lose even the cell membrane, and we get keratin filament which is present on the surface. So newly formed keratinocytes push the older ones towards surface. In 30 to 40 days, a keratinocyte makes its way to the skin surface and flakes off. This process is slower in the old age, faster in skin injured or stressed. Callus or corns, they are basically thick accumulation of dead keratinocytes on the hands and foot. Now let us explain this process. In this diagram you can see in the stratum basale, the cells are columnar in shape. They contain less keratin. Columnar cells being most active metabolically, so they occupy their place towards the dermis, which is highly vascular, so they are close to the nutrition. As the cells move from basal layer towards the surface, their shape changes. From columnar, they become cuboidal, and as they go further away, they become squamous cells, producing more and more of keratin. They lose their nucleus, cell membrane, and finally are shed out as or exploded as keratin filaments, which is basically a dead tissue. So from this slide we get that most metabolically active cells are columnar and least metabolically active cells are squamous, and in between the two cells lies cuboidal epithelium. Now, what is the second layer of the skin is dermis. Dermis is dense connective layer below the epidermis. Thickness of the dermis ranges from 0.2 millimeter in eyelids to 4 millimeters in palms and soles. So thickness of the skin is determined by the thickness of the dermis. It is composed mainly of collagen, elastic and reticular fibers, fibroblasts. It is rich in blood vessels, nerves, and lymphaticus. It contains sweat and sebaceous glands, which are appendages of the skin, and also nerve admixus, since skin being the largest sensory organ of our body. Dermis is further divided into two layers. Superficial layer is called the papillary layer of the dermis, and the deeper layer is called the reticular layer of the dermis. Now, hypodermis is also called the subcutaneous fat. Hypodermis contains a lot of adipose tissue in addition to blood vessels, nerves, and lymphaticus, because blood vessels, nerves, and lymphaticus reach dermis through hypodermis. It is more areolar and adipose than dermis. It binds skin to the underlying tissues. It contains subcutaneous fat. Subcutaneous fat is 8% thicker in women than in men. The function of subcutaneous fat is it pads our body, acts as a reservoir of energy. It also insulates our body. Drugs introduced in hypodermis are absorbed there due to its high vascularity. What is dermo-epidermal junction? To understand the anatomy of dermo-epidermal junction, let us go to this slide. In this slide, you can see the three layers of the skin: epidermis, dermis, and hypodermis. In addition, there is deep fascia and muscles covered by the deep fascia, which are not included in the skin. In the next figure, you can see the egg trays lying one over the other, and this is the dermo-epidermal junction. Now let us go to the dermo-epidermal junction. So on the left side of this slide is dermo-epidermal junction. Below dermo-epidermal junction, you can see how they simulate the egg trays lying one over another. What are epidermal ridges of skin? A pattern of elevations or ridges and depressions or grooves on the deep surface of the epidermis fit a complementary pattern of corrugations of the underlying dermis. The projections of the dermis are called the dermal papillae, and those of the epidermis are called epidermal ridges or pegs because of their appearance in vertical sections of the skin. The stratum basale rests on the papillary layer of the dermis. The dermo-epidermal junction is wavy. I stress the term wavy, where finger-like projections from papillary layer of the dermis, called the dermal papilla, interlock with the epidermal ridges from stratum basale as shown in this diagram. The papillary layer of the dermis constitutes about 25% of the thickness of the dermis. It consists mainly of elastic connective tissue and contains blood vessels, touch receptors and nerve endings. This is just like the interlocking of the two egg trays, the upper one forming dermal ridges and the lower one forming dermal papilla. As shown in this diagram, from the side of the dermis we have dermal papilla. From epidermal side we have dermal ridges. These dermal papilla fit in the spaces between the two dermal ridges and interlock the epidermis with dermis. This interlocking increases the cohesiveness between epidermis and dermis. This interlocking prevents separation of epidermis from dermis as shown in this diagram. So dermal papilla are sometimes called dermal pegs, which are protrusions of dermis into epidermis. The papilla is derived from the Latin papilla meaning pimple. What are the functions of dermal papilla? As already said, interlocking of dermis with epidermis reduces chances of separation between the two. Since dermal papilla contain a lot of blood vessels, they provide blood supply to the epidermis, thus providing oxygen and nutrients to the epidermis and removing waste products from it. Epidermis performs only protective function. Dermis also provides sensory supply to the epidermis for pressure, pain, cold and heat. In palms and feet, these papillary ridges are visible in the form of epidermal ridges, which form the basis of fingerprints. This pattern is unique even in identical twins, thus helps in identification of individuals. The study of fingerprints is called dactylography. Nowadays, fingerprints are used for biometric attendance and identification. These dermal papilla are peg-like structures from epidermis that interlock with epidermal ridges to increase the adherence between the two layers. In addition to this, they also contain blood vessels and nerves. So contents of dermal papilla are blood vessels, lymphaticus and nerves. Dermal papilla interlock and increase the adhesion between the epidermis and dermis. They contain blood vessels, lymphaticus for nutrition of epidermis and removal of waste products from it. They also have sensory functions. Now what is dactylography? Dactylography is, as already said, is the study of the fingerprints. Nowadays fingerprints are used for biometric attendance. Anatomically they are epidermal ridges on the surface of palms and soles as shown in this diagram. They are produced by underlying dermal papilla. Every individual has unique pattern which is formed during fetal development and remains unchanged throughout the life. Even two identical twins have different fingerprint pattern. This helps in the identification. Now what are the various second markings? Flexion creases. These are lines on the flexor surface of the digits, palms, wrists and hand. It marks sites where skin folds during flexion of the joints. Skin incisions in case of neck are to be given along the flexion lines for better cosmetic result. For example, during thyroid surgery, we give a transverse incision along the flexion creases of the neck so as to get a better cosmetic result. I want to summarize my lecture as skin is the largest organ of the body. It consists of three layers. Epidermis, which is avascular keratinized layer for protection. Epidermal cells include stem cells, keratinocytes, melanocytes, and tactile cells. Dermis is highly vascular layer consisting of outer papillary and inner reticular layer. It contains blood vessels, lymphatics, and nerves. It gives elasticity to the skin nourishes and innervates epidermis. Hypodermis or subcutaneous layer contains fat and is important for fat metabolism and insulation of body. Now let us go for a quiz based on this lecture. The largest gland of body is skin, pituitary gland, liver, adrenal gland. Skin is also regarded as the largest gland of our body. The pigmentation of skin is primarily due to melanin, keratin, hemoglobin, none of the above. Melanin produced by melanocytes is responsible for pigmentation of the skin. Since congenital absence of this pigment leads to albinism. As shown in this figure, melanocytes synthesize the melanin. They determine the pigmentation of the skin. So in different races, we have different content of melanin and accordingly different pigmentation of the skin. Which one of the following is not true of dermal papillae? They are avascular, contain lymphaticus, dermal papillae hold together epidermis and dermis, nourishes epidermis. So they are highly vascular. So A is the wrong statement. False statement about albinism is it is due to congenital absence of melanocytes. Hypopigmented areas patchy in distribution. Vision is not normal. It is due to the defective melanin production. B is false statement as in albinism we have generalized hypopigmentation of the body. Which of the following is false about thick skin? Present in palms and soles. It is rich in sweat glands, lacks sebaceous glands, contains hair follicles. D is wrong option. Which of the following drugs are absorbed through the transdermal route? A. Lipid soluble drugs. B. Water soluble. C. Both. D. None of the above. It is only lipid soluble drugs that are absorbed through transdermal route. Thank you for watching. Do not forget to like, subscribe and share this video.
Do not forget to subscribe my channel. Press on the bell icon to remain updated about more video uploads.